A breath of hope understanding COPD in the UK. Chronic obstructive pulmonary disease, or COPD, is a serious lung condition affecting millions worldwide. COPD is characterized by long-term breathing problems and poor airflow. The main symptoms include shortness of breath, cough, and sputum production. It is a progressive disease, meaning it typically worsens over time. In the UK alone, an estimated 1.2 million people are living with a COPD diagnosis. This number is likely even higher, as many cases go undiagnosed until the disease has progressed significantly. Early diagnosis and management are crucial in slowing the progression of COPD. Regular checkups and lung function tests can help in identifying the disease at an earlier stage. COPD poses a substantial burden on the UK's healthcare system and economy. The cost of hospital admissions, treatments, and long-term care for COPD patients is significant. Beyond the numbers, COPD deeply impacts the lives of those affected and their families. The physical limitations can lead to a loss of independence, making daily activities a struggle. Simple tasks like climbing stairs or even talking can become incredibly challenging. This can lead to a decrease in quality of life and increased reliance on caregivers. The fear and uncertainty surrounding this progressive disease can take a toll on mental and emotional well-being. Support groups and counseling can provide much-needed emotional support and coping strategies. However, recent advancements in COPD treatment offer a beacon of hope for a brighter future. New medications, pulmonary rehabilitation programs, and innovative therapies are helping patients manage their symptoms more effectively and improve their quality of life. The unseen struggle symptoms and causes of COPD. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes it increasingly difficult to breathe. It is a condition that affects millions of people worldwide, yet many remain unaware of its early signs and underlying causes. COPD is characterized by persistent airflow limitation and breathing difficulties. This means that the airways in the lungs become narrowed, making it hard for air to flow in and out. This can lead to a feeling of breathlessness that can be quite distressing. This occurs due to long-term damage to the airways and tiny air sacs in the lungs, making it hard to breathe in and out effectively. The damage is often irreversible, and it can significantly impact a person's quality of life. While the symptoms often develop gradually, they tend to worsen over time, leading to a decline in lung function. Early detection and management are crucial to slowing the progression of the disease and maintaining a better quality of life. The most common symptom of COPD is shortness of breath, especially during physical activity. This can make everyday tasks, such as walking upstairs or carrying groceries, feel exhausting and challenging. Other typical symptoms include wheezing, which is a high-pitched whistling sound when you breathe, and a persistent cough that produces phlegm, frequent chest infections, which can be particularly severe and require medical attention, and a tight feeling in the chest. This tightness can often be mistaken for other conditions, making it important to seek medical advice if you experience these symptoms. The primary cause of COPD is prolonged exposure to irritants that damage the lungs and airways. These irritants include tobacco smoke, air pollution, chemical fumes, and dust. Smoking is the leading cause, but non-smokers can also develop COPD due to environmental factors and genetic predispositions. Current therapies: managing a life with COPD. While there is currently no cure for COPD, various treatments are available to manage the symptoms, slow down the progression of the disease, and improve the quality of life for those affected. These treatments typically focus on relieving symptoms, reducing the frequency and severity of exacerbations, and improving exercise tolerance. Common COPD treatments include bronchodilators, which help relax and open up the airways, making breathing easier. Inhaled corticosteroids are another option, working to reduce inflammation in the airways. Pulmonary rehabilitation programs combining exercise, education, and support are also beneficial. However, these treatments have limitations, and many patients continue to experience debilitating symptoms. A new era, introducing Mepolizumab for COPD treatment. A novel treatment option, Mepolizumab, offers renewed hope for individuals living with COPD, particularly those with a specific type of severe COPD characterized by frequent exacerbations, known as eosinophilic COPD. Administered as a monthly injection, Mepolizumab belongs to a class of drugs known as monoclonal antibodies, which work by targeting specific proteins in the body's immune system. Mepolizumab specifically targets a protein called interleukin-5, or IL-5, which plays a crucial role in the inflammatory process in the lungs of people with eosinophilic COPD. By blocking IL-5, mepolizumab helps reduce inflammation and airway hyperresponsiveness, leading to improved lung function and a reduction in exacerbations. Section 5. Breakthrough results: the evidence behind mepolizumab. Clinical trials have demonstrated the efficacy and safety of mepolizumab in treating patients with severe eosinophilic COPD. In a large-scale study involving over 1,000 participants, mepolizumab significantly reduced the frequency of exacerbations compared to a placebo. The study also showed improvements in lung function, quality of life, and respiratory symptoms in patients receiving mepolizumab. These findings highlight the potential of mepolizumab to transform the lives of COPD patients who experience frequent and debilitating exacerbations. The ability to receive treatment once a month through a simple injection offers convenience and improves adherence compared to daily medications. Section 6. Patient voices: real-life experiences with mepolizumab. For many individuals living with severe COPD, mepolizumab has been life-changing. This medication, designed to target and reduce inflammation in the airways, has provided a new lease on life for many patients who previously struggled with daily symptoms and frequent exacerbations. Patients report a significant reduction in exacerbations, allowing them to breathe easier, engage in daily activities with greater ease, and enjoy a better quality of life. Simple tasks that were once daunting, like walking in the park or climbing stairs, have become manageable and even enjoyable. The decreased reliance on rescue medications and hospital visits has also positively impacted their overall well-being. Many patients have shared that they feel more in control of their health and less anxious about sudden flare-ups that previously led to emergency room visits. One patient shared, "Since starting mepolizumab, I can finally breathe again. It's like a weight has been lifted off my chest, and I can do things I never thought possible. I can walk up the stairs without gasping for air, and I haven't had to go to the hospital for an exacerbation in over a year. This medication has truly transformed my life." These real-life experiences underscore the transformative potential of mepolizumab in managing COPD and improving patients' lives. The stories of renewed independence and enhanced quality of life highlight the importance of innovative treatments in chronic disease management. For many, mepolizumab is not just a medication, it's a beacon of hope and a step towards a healthier, more fulfilling life. Section 7. Expert opinions: medical professionals weigh in. Medical professionals specializing in respiratory health have expressed optimism about the potential of mepolizumab to address an unmet need in COPD treatment. They acknowledge the significant impact it can have on patients with frequent exacerbations, emphasizing its ability to reduce exacerbations, improve lung function, and enhance quality of life. Dr. Sarah Jones, a leading pulmonologist in the UK, remarked, "Mepolizumab represents a significant advancement in COPD treatment. It offers a targeted approach for a specific group of patients who often struggle to manage their condition effectively. The clinical trial results are encouraging, and we are seeing positive outcomes in our patients." Section 8. Looking ahead, the future of COPD treatment. The introduction of mepolizumab marks a turning point in COPD management, offering a new avenue for treating this chronic and often debilitating disease. As research continues to unravel the complexities of COPD, targeted therapies like mepolizumab hold great promise for improving patient outcomes and alleviating the burden of this respiratory illness. The future of COPD treatment lies in early diagnosis, personalized medicine, and innovative therapies tailored to individual patient needs. With continued research, collaboration, and advancements in healthcare, there is hope for a future where COPD is no longer a life-limiting condition. Section 9. Conclusion: a new dawn for COPD patients. Mepolizumab emerges as a beacon of hope for individuals living with COPD, particularly those with frequent exacerbations. This innovative treatment option signifies a paradigm shift in COPD management, offering the potential for a brighter and healthier future for countless individuals. As we move forward, it is crucial to raise awareness about COPD, promote early diagnosis, and ensure access to effective treatments like Mepolizumab. By working together, we can empower individuals with COPD to breathe easier